Okay, well, good. This is time for the videos. Let's see if I can get these to work. Now, before we move on, so let's see, we have this lady. I know how to do this, I think. It's sound. Oh, yeah, sound. Okay, yeah, the sound is important. So while he's getting the sound connected, I want to talk to you about this lady. I have a few of these. Now, this lady is Georgia. She is actually the mother of a physician in town. She's an avid hunter. She and her husband like to go bow hunting. She started having problems getting out with her husband and getting out in the forest and up on the stands. Couldn't climb the trees. Are we going to get the... We can always put it down here and do that. So what I want to demonstrate here is that she's already had the surgeries. You can see her hair is shaved. And she will have difficulty moving. So let's see. I think it goes like this. I don't hear anything. But you can see, while he's getting the sound, it's really just impressive to watch the video. So what we do in the clinic is we just basically get them to perform maneuvers. And in this time, you'll see that her walking is very shortened steps. Sorry, that was my fault. Now she has the device implanted, but it's not on. And we have the ability to turn it off and on with a device that they carry around. Notice how she has difficulty getting around the door. That's a particular obstacle for patients. So there's some visual spatial problems that as they enter through a threshold, you can see how a patient like this would fall easily. Can you imagine her climbing up a deer stand? This tests for postural stability. This is how we see a normal person shouldn't take too many steps backwards, but watch her. I mean, she just falls like a tin soldier. Yeah. Okay. Now, the next is after we've turned her on, just a few minutes later.
We're at 4.5, 90. 135.
This is the device we use.
Case 1 negative, 2 positive.
Look how much different she walks. She can walk through the door. She takes bigger steps. She swings her arms, whereas she wasn't even doing that before. I'm not so sure she gets up on a deer stand, but she does say that she's bow hunted from her husband's truck, so that's a major advancement. I think she got a couple turkeys last season. Now, okay, let's see. So this man, I wanted to show you a picture of essential tremor. So the difference between what you just saw and what you will see is this lady here has essential tremor. It's an action tremor. And you'll see that it affects when she's doing something. And it is not the same as the other features that you see in Parkinson's, which are mostly rigidity and non-movement. Let's see here. Again, she's post-surgery, so her head's shaven. And we do the Archimedes spiral, that's my drawing. She's supposed to copy that. Lines are not supposed to touch. And the...
Do it right there, so. I can't hold it. Try your best. You're going to do it before and after, Steve.
She can barely put the tip of the pen on the paper.
Okay, can you sign your name?
So don't let it fool you. This has also been called benign essential tremor. There's nothing benign about what's going on with her. It's affected her daily life significantly. And this is just a few minutes later after we turned her on. Notice, I don't think we captured her writing, but, well, we did a little bit. But notice she can write numbers. I mean,
Yeah. Yeah. Let's we'll save some of the thing for this device here.
okay. Okay, let's see. Now, this man has got Parkinson's disease, and the fortunate thing about this video is that it's all continuous. So you'll see, not it's spliced up, but you'll actually see it as I turn him on. So I want you to observe his tremor is a little unusual for Parkinson's. It's usually not that dramatic, and you'll just watch.
Mr. Chadwick, the date is January the 28th. Yeah. And this has been the tremor that bothers you the most. Now, so you can't, tell me what you cannot do when this is at its worst. Basically everything. And
You can see the wire.
Your medications, how frequently?
Every 4 hours.
And sometimes when the programmer is working properly, you can go how long?
I go 5 hours or 3 to 6 hours.
Okay. So continue filming. We're going to turn you on because we finally established a good level. And,
Oh, I'm sorry. Gosh, that was... Oh. Yeah. Let's go back to it. Sorry about that. I'm spinning out of control. Yeah. So notice how dramatically it changed. And it was right in front of our eyes. It just melts away. This man chose to have it on one side only. Yeah. Sorry for the interruption. I didn't mean to interrupt it, but it was continuous, and you kind of saw how it all melted away. And and lastly, this was the one that this was our mascot. And
Parkinson's disease is a degenerative disease.
Not me, I mean the patient.
Those people that are affected by Parkinson's are particularly challenged with the movements of their body, and they're challenged by tremor and rigidity, which is a feeling like they're walking through the mud all the way.
This is the last one.
Sometimes it's hard for me to go on the body. When I go in the restaurant, I feel like everybody was looking at me because I feel all that inside.
In about 5 to 8 years, they stop seeing the really good benefits of the medication, no matter how many you use, and the disease unfortunately marches on. But what we're able to do is to improve their daily living, and with the use of the surgical treatment, the deep brain stimulator, the part that goes in the brain is this very slim catheter, and at the very tip end there's a selection of 4 electrodes which can be adjusted after the patient comes to the office. And the patient remains awake during the procedure, which is exciting as well. About 2 weeks after that, the patient comes back to our clinic and has the initial program. And that's when they start seeing the real benefits begin. You might know we're communicating with the neurostimulator. So you want to turn on first. dedicated neurosurgeons to help us implant this, whereas before we were working closely with the universities. The patients would have to drive several hours either to Kansas City or St. Louis or any nearby university, and to see them improve dramatically after they've seen some of their various medications waning in effect is very rewarding. Hold them straight out there. Oh yeah, you just follow the business in the world.
So the implants improved my life by 90%. Just like that. Yeah, it was so good.
Thank you. I think it's an exciting time to be in the healthcare field. I hope you take every opportunity to learn as much as you can and continue to learn, because I never stop learning. Thank you.